Welcome to this educational video on esophageal ulcers. Today we'll delve into the causes, symptoms, diagnosis, treatment, and prevention of this uncomfortable condition affecting the esophagus. Esophageal ulcers, breaks in the lining of the esophagus, can arise from a variety of factors. One major culprit is chronic acid reflux, also known as GRD, where stomach acid repeatedly flows back into the esophagus, eroding the tissue. Another significant cause is infection, especially by Helicobacter pylori, the same bacteria that can cause stomach ulcers. Certain medications, particularly NSAIDs like ibuprofen and aspirin, can also damage the esophageal lining, especially when taken long-term. Less commonly, conditions like Barrett's esophagus and certain viral infections can contribute to ulcer formation. The development of an esophageal ulcer is a multi-step process. Initially, the protective mucosal lining of the esophagus is damaged by prolonged exposure to acid, medications, or infectious agents. This damage leads to inflammation and erosion of the superficial layers. If the underlying cause persists, the erosion deepens, penetrating the esophageal wall and forming an ulcer. This process is exacerbated by the esophagus's limited ability to heal quickly, making it susceptible to further damage from acid or other irritants. Esophageal ulcers are relatively common, affecting a significant portion of the adult population, particularly those with GRD. The prevalence is higher in individuals who frequently use NSAIDs, smokers, and those with a history of H. pylori infection. Age is also a factor, with older adults being more susceptible due to age-related weakening of the esophageal lining and slower healing processes. Specific demographic data on the exact prevalence can vary depending on the study and population examined. The signs and symptoms of esophageal ulcers can range from mild discomfort to severe pain. Heartburn, a burning sensation in the chest, is a common symptom, especially after meals or when lying down. Difficulty swallowing or dysphagia may also occur, as the ulcer can narrow the esophagus. Pain behind the breastbone, often described as a sharp or stabbing pain, is another frequent symptom. In severe cases, ulcers can bleed, leading to blood in the vomit, dark or tarry stools, and even anemia. Some individuals may also experience nausea and unintentional weight loss due to difficulty eating. Diagnosing an esophageal ulcer typically involves a combination of a physical exam and diagnostic testing. The most common and effective method is an upper endoscopy, where a thin, flexible tube with a camera is inserted into the esophagus to visualize the lining and identify any ulcers or abnormalities. Biopsies may be taken during the endoscopy to rule out other conditions, such as cancer, or to test for H. pylori infection. A barium swallow X-ray can also be used, but it's less sensitive than endoscopy. This involves drinking a barium solution, which coats the esophagus, allowing X-rays to reveal ulcers or other irregularities. Esophageal ulcers aren't typically classified into distinct types, but rather based on their severity, location, and underlying cause. We can categorize them based on their depth, superficial or deep, their location, whether they're closer to the stomach or the throat, and their etiology, such as ulcers caused by acid reflux versus those caused by medication. Treatment for esophageal ulcers focuses on reducing acid production, protecting the esophageal lining, and eradicating any underlying infections. Proton pump inhibitors, or PPIs, are the mainstay of treatment, as they effectively suppress acid production in the stomach. H2 receptor antagonists can also be used to reduce acid secretion. Antibiotics are prescribed if H. pylori infection is present. Sucralfate, a medication that coats and protects the ulcer, can promote healing. In rare cases, if the ulcer causes severe bleeding or complications, surgery may be necessary. Lifestyle modifications such as avoiding trigger foods, quitting smoking, and raising the head of the bed are also important for managing symptoms and preventing recurrence. Preventing esophageal ulcers involves addressing the underlying risk factors. Managing GRD through lifestyle changes and medication is crucial. Avoiding NSAIDs or taking them with food and with a PPI can reduce the risk of medication-induced ulcers. Eradicating H. pylori infection is essential if it's present. Maintaining a healthy weight, avoiding smoking, and limiting alcohol consumption can also contribute to preventing ulcer formation. Regular check-ups with your doctor can help identify and manage risk factors early. The prognosis for esophageal ulcers is generally good with appropriate treatment. Most ulcers heal completely within a few weeks to a few months with medication and lifestyle changes. However, recurrence is common if the underlying cause is not addressed. Recent research is focusing on developing more targeted therapies to promote faster healing and prevent complications. Studies are also investigating the role of the gut microbiome in esophageal health and the potential for probiotic interventions to improve outcomes. Additionally, minimally invasive endoscopic techniques are being developed to treat bleeding ulcers and other complications more effectively.